Good afternoon and welcome to the Center for Disaster Philanthropy webinar, COVID-19, Bereavement, Grief, and Mental Health. My name's Tanya Gulliver-Garcia and I'm the Assistant Director of Major Initiatives at CDP. This webinar is presented in partnership with New York Life Foundation and is co-sponsored by Interaction, National Voluntary Organizations Active in Disasters, the Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, the United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. Just a few reminders before we get started. This webinar is being recorded, and it'll be available on our website and on our YouTube channel shortly after the webinar is complete. And everyone who's registered will be sent a link to the recording in the next couple of days. You can submit questions at any time during the using the question and answer box, the Q&A box, and they will be answered at the end of the panel presentation. And if you're on Twitter, we'd love for you to use the hashtag CDP4Recovery, that's the number 4, to share the discussion. So today's webinar is designed to help the funding community continue to gain more information about the intersection of mental health and the COVID-19 pandemic. Our discussion will cover information on what professionals are seeing as individuals, families, and communities weather the stresses of illnesses, deaths, and economic impacts. We'll look at the role of cultural sensitivity in addressing the traumas of disaster. We'll examine how funders are responding to the enormity of the losses and examine and explore opportunities for innovative and collaborative grant making. So worldwide, as of this morning, and that's July 14th for those who are watching later or those who, like me, have completely lost track of what day it is, there are more than 13 million confirmed cases worldwide, 575,000 deaths, and 7.6 million people have recovered. So a little more than half of folks have recovered. In the United States, there are more than 3.4 million confirmed cases, 138,000 deaths, and 1.5 million have recovered. After the US, the countries with the highest number of cases are Brazil, Russia, India, and the UK. And we're seeing growth in a number of other areas. And that includes a massive resurgence in cases here in the US, with Florida recording more cases daily than New York City saw at the peak. And as a country, cases are now ranging from 50 to 70,000 daily. Again, this is higher than we saw earlier this year when we averaged 20 to 30,000 a day. So many states have implemented mask mandates and are starting to roll back or pause their reopenings. So it's a great time for us to begin this conversation. We know from the descriptions of researchers such as David Abrahamson at New York University that people in communities who've experienced a weather-related disaster or really other disaster events go through a series of reactions to the event over a long arc of recovery. And these reactions may be more or less complicated due to pre-existing physical and mental health conditions, the social networks they have that may bring attention and security, political power that gives communities a seat at the table for determining their own recovery, economic capital such as income, stable housing, and insurance, and access to mental and behavioral health diagnostic and treatment care. We also know that for a variety of reasons, many survivors are not identified as needing mental health care, or they don't present themselves for assessment until long after the initial event is over. The media attention and the financial support have gone. In the case of the current pandemic, where the footprint of the disaster is so vast and our timeline of the so-called event has stretched over many months already with, as I mentioned, upticks and even potential of future outbreaks, we may be in new territory in both assessing risk, evaluating impact, and supporting interventions in mental and behavioral health. And we also know that mental health, unfortunately, does not receive a large share of the funding support for disaster recovery. With our partners at Candid, we've been able to track philanthropic grants from 2012 to 2019 for mental health services following a disaster. When you consider that this chart covers 7 years, which included Superstorm Sandy, the Ebola crisis, and a series of major hurricanes like Harvey, Irma, and Maria, the numbers look very small, particularly in comparison to other facets of recovery. So with that very happy and cheery opening, I'd now like to introduce our guests. Lisa Furst is a social worker and public health professional and assistant vice president at Vibrant Emotional Health, where she oversees the Center for Policy, Advocacy, and Education. She directs a variety of training and technical assistance efforts and advocates for sound policies and practices in mental health. And she regularly provides training in psychological first aid to increase the capacity of non-clinical service providers to address emotional health needs after a disaster. Next, we have Huong Diep. Dr. Diep is a bilingual, English and Spanish, board-certified psychologist specializing in global mental health with an academic emphasis in international disaster psychology. Her clinical experience includes providing direct services, training, and consultation in international settings, and with the Headington Institute as a consultant in the areas of resilience and vicarious trauma. Dr. Diep is passionate about the intersection of gender, language, and culture while providing gender-affirming care to the LGBTQ+ community. And last but not least, we have Heather Nestle, who is president of the New York Life Foundation, the charitable foundation created by the New York Life Insurance Company. In addition to her foundation duties, she's vice president of New York Life's Corporate Responsibility Department. She was the 2018 recipient of the Charlie Award from Chief Executives for Corporate Purpose to recognize perseverance in the pursuit of societal advancement and is a member of the Philanthropy New York CEO Forum. So welcome to all of you, and thank you to our panelists for taking time away from your work to speak with us today. So I'm going to move into our moderated questions first. And as a reminder, if the audience has questions, put them in the Q&A box and we'll get to them at the end of the panel. So Lisa and Huong, let's start with you. Just tell us a little bit about what you're seeing and hearing in general in your work. And Lisa, why don't you go first?
Great, thank you. So we're seeing both the incredible efforts that healthcare, behavioral healthcare, and other frontline service sectors are making to serve people affected by COVID. And we're also seeing how it's taking its toll and how varied that is. So we're seeing that the emotional toll of the pandemic varies quite a bit depending on what region is having an uptick or not, and what the impact of the pandemic has been, not just in terms of health, but also the economic impact and other impacts related to social determinants. So it's been quite a varied national response.
And Huong, how about you?
Yeah, thank you for allowing me to share a bit of what I'm seeing in my private practice and also consulting with Headington Institute, where the motto is providing care to the caregivers. So from young adults to adults and from local California clients to my international clients, what I'm seeing is just a global collective trauma that's impacting all of us in very unique ways. There's an underlying current of fear, sadness, hopelessness, demoralization, and grief, but also creativity and resilience at learning how to adjust to our new norm. In addition, in my trauma-informed, culturally sensitive, and intersectional work with different racial, ethnic, gender, and sexual minority groups, they are unique stressors that have either exacerbated previous traumas or triggered new trauma responses. And unfortunately, I believe we're only seeing the tip of the mental health iceberg at this moment, and that the real work is yet to come.
Lisa, let's turn back to you. In your work at Vibrant, you receive calls 24/7 in response to both big and small disasters. Are there characteristics of the calls related to COVID or certain populations that you believe to be particularly impacted? And how has your referral or response process changed in reaction to all of this?
Thanks for such a great question. So for those who don't know, Vibrant Emotional Health administers two 24/7 national hotlines, including the Disaster Distress Helpline and the National Suicide Prevention Lifeline. And locally in New York City, which is where we're based, we also operate a 24/7 hotline for the city called NYC Well, which happens to also be part of the National Suicide Prevention Lifeline. So what we're seeing, just building on what Dr. Diep was saying, certainly we're having folks across the hotline systems report things like anxiety, symptoms of depression, fear and uncertainty, concerns about their jobs, concerns about their health, concerns about their family's health, far-ranging impact. What we're also seeing, though, is a diversity in how that is manifesting in terms of levels of request for service across the different hotlines. So, for example, on the national level, we saw that the disaster distress helpline call volume increased with the advent of the pandemic and then peaked in April. And that is pretty consistent with the chart that you showed earlier about how disasters unfold and how often there is an immediate spike in people reaching out for help during the response phase. And there often is a reduction in volume as people achieve stability following the immediate impact of the disaster. So that's not surprising. However, because this disaster is ongoing and varies from region to region, what we're seeing also is that the disaster distress helpline call volume has remained higher overall and is not at pre-COVID levels, even though the peak happened in April. On the other hand, the National Suicide Prevention Lifeline call volume does not yet seem to have peaked. And we think in part this may be due to localities promoting the availability of their local crisis centers that are part of the Lifeline. So folks may be aware more of their local crisis center than the Lifeline number as a whole. And so they may be reaching out directly locally rather than getting to their crisis center in their region through calling the Lifeline. We do anticipate that overall volume could increase over time as more areas of the country are more severely affected by the pandemic and other factors such as job and income loss and housing insecurity increase as a result. And then locally, where I am in New York City, we saw that our local call volume began to increase in March and peaked in May. And similar to the DDH, our volume has remained consistently higher since then than in the same period last year. So for example, in June of 2019, NYC Well in New York City had 28,000 incoming contacts, but in June of this year, we had over 36,000. So we do attribute that increase to the COVID pandemic. We're also seeing that people are reaching out more via chat than by phone or by text. And we believe this is due to privacy concerns. People may feel like they could be overheard or seen if they were using the other methods of getting in touch. And in terms of the process, our process of providing service has not changed and our referral process hasn't changed. However, as an example of the reaction to the uptick in our local needs in New York City, we have increased our staffing to accommodate the increased volume.
Thank you. It's very interesting statistics about the increase. So what advice would you have for funders about supporting crisis mental health, long-term mental health, or mental health needs that are yet to emerge?
So funders are often focused on meeting the immediate needs that occur in the recovery phase right after impact, which is always necessary and important. However, I think there is a real opportunity for funders to focus their efforts into longer-term recovery phases following disasters, because that's when mental health issues often emerge for people, either because they've stabilized enough materially to be able to address a mental health need, or because other short-term mental health and other supports may have been withdrawn, as you indicated earlier in the webinar. It's important for funders to track the social determinants of mental health and strategize around meeting the mental health needs of those who are experiencing prolonged periods of income loss, joblessness, housing or food insecurity, because these material issues are often the drivers of emotional distress and the exacerbation of pre-existing mental health challenges and those that emerge as a result of the disaster. It's also really critical for funders to support outreach to underserved communities and to partner with local and diverse organizations in those communities to ensure that the mental health response is tailored to and driven by the unique needs of those communities. And it's important not to think in a one-size-fits-all way.
They're going to be different depending where you are and who you're dealing with.
Yes.
So Huong, let's turn to you. I know you have a lot of international experience, and this is a global pandemic, and then you have your current practice here in the US. How does what you're seeing now compare to prior disasters you've experienced?
Yeah, great question. I mean, typically, after a catastrophic disaster, such as an earthquake, normalcy resumes a few hundred miles away. However, this is not so in a global pandemic. And so in essence, there are no safe zones anymore. So all of us are simultaneously experiencing and grieving during this disaster. And therefore, our emotional bandwidths are stretched and limited. Not only are we asking folks trying to hold space for the narratives and traumas of their clients and beneficiaries, but also holding space for their own concurrent traumas and having to strike that delicate balance. And especially here in the US, what we're seeing with the intersection of the political, economic, and social injustices, there's just a general sentiment of unease and lack of physical and emotional safety. Because as we know from Maslow's hierarchy of needs, the base of the pyramid includes our physiological needs, food, water, shelter. Those basic needs are to be established before we're able to ascend to becoming our best selves. So what happens to those who are stuck at the bottom of the pyramid and have no shelter in which to shelter in place, or standing in line for 8 hours at food banks, potentially exposing themselves to COVID-19? In addition, with the humanitarian aid workers I consult with, there's an additional cognitive load with questioning their own safety versus the safety of the communities they're working with. Local and international disaster responders are experiencing heightened levels of sadness, anger, and fear associated with not knowing what COVID-19 will do to the under-resourced communities they care about. For example, handing out soap and hygiene to communities without water, and also experiencing moral injury, debating between, conflicts of I'm not doing enough versus I need to take care of myself and my family. So what I see is that many of my clients are wrestling with questions that unfortunately have no clear-cut answers. And the unknown of it all makes it hard for any of us to plan or to have something to look forward to. And I remind my clients that this is a global exercise in focusing in on the now and what we can truly control.
All right, I think we lost Tanya, so I will jump in here and ask the next question. So as we know from the reported statistics, COVID-19 is a disease that is disproportionately affecting different communities, a factor which is embedded in health access, poverty, gender, and race. This appears to be the time for philanthropy to double down on supporting vulnerable populations and at-risk communities. Who are some of these communities in need? And what should funders understand about funding mental health services?
One particular group that I work with that is especially vulnerable are the LGBTQ plus youth. So lesbian, gay, bisexual, transgender, queer questioning. LGBTQ youth are already a vulnerable population and are higher risk for anxiety, depression, homelessness, and self-harm as compared to their non-LGBTQ peers. For example, in a 2018 study in the Journal of American Medicine Association, also led by researchers at Harvard University and the Fenway Institute, they found that transgender youth were at a greater risk for attempted suicide, depression, and anxiety, and that gender-affirming mental health services are greatly needed to address these concerns. Therefore, during this pandemic, there can be additional challenges and risks resulting from limited access to community support, especially for those who live in rural areas and are socially distancing, a lack of gender-affirming services, such as different procedures and surgeries due to COVID-19 closures, and in some cases, the difficult and potential unsafe circumstances of quarantining with unsupportive family members who are using the wrong pronouns and names. Also, if we look at communities through an intersectional lens, we can see how LGBTQ youth of color face additional stressors and challenges, especially during these times with xenophobia, Black Lives Matter movement, and social injustices. Using the minority stress model, it is crucial that we understand the internal and external stressors that members of minority groups experience that build up over time and can ultimately lead to adverse physical and mental health outcomes. Therefore, I would highly encourage funders to recognize that some of the mental health needs of marginalized groups will not be immediately apparent, because some folks may have a delayed reaction to their traumatic stressors and also may not have the language or vocabulary to describe their emotional reactions. For some, they are actively using denial, compartmentalization, and minimization as immediate coping strategies to holding back the dam of overwhelming emotions in order to continue showing up to work and surviving on the daily. For example, with symptoms of post-traumatic stress disorder, PTSD, some folks may exhibit delayed symptoms that are not evident until about 6 months to a year or maybe even a few years after an event. And from a culturally informed model, different cultures and groups manifest distress in unique ways, such as through somatic complaints. Therefore, as what Lisa said, it's important to have a long-term view in terms of interventions and funding for mental health concerns.
Great, thank you. Now I have a question for both Lisa and Huong. So when we think of first responders working on the front lines of the pandemic, we often imagine fire departments, EMTs, physicians, and other medical care professionals. What are their mental health needs and the needs of those who are providing their mental health care? Huong, let's start with you.
Yeah, what I'm seeing is that healthcare workers and other first responders are so well trained in managing the intensity of a medical crisis or disaster. However, few are equally comfortable managing the mental health aftermath in themselves or in others. We know that even before the pandemic emerged, moral injury and burnout were rampant amongst these groups. So coping with COVID-19 has just magnified some of these challenges and added new ones with the reality of resource constraints. So what I'm seeing in my clients and in the news is just a higher level of stress and perceived responsibility, which in some cases has led to safety concerns and unfortunately suicide. There needs to be additional channels of mental health support for these folks with decreased stigma for seeking help. Unfortunately, helpers are notoriously bad at seeking help. And so it's been my mission to work with organizations at changing their policies to foster a workplace environment where mental health needs are openly discussed and validated.
Great, thank you. And Lisa, what about you? What are you seeing?
Building on what Dr. Diep has shared, we've certainly heard about distress actually related to the need for really accurate public health guidance. And among this population, we would think that they'd have better access to it than the general public, but that hasn't always been the case. As well as concerns related to the stress of providing care and services to people who were sick without necessarily having the equipment they really needed or personnel in adequate numbers to manage the work, contributing to the burnout that was referenced earlier. We've also heard about the challenges of developing new coping skills when the pandemic has curtailed the usual ways in which folks are coping. So if someone couldn't exercise in a gym or in a park when those areas are off limits, how do they exercise if that's one of their main coping skills? So that's been a real challenge about developing new strategies. And as Dr. Diep indicated, this is a group that can really struggle with reaching out for help, as so many pride themselves on being the helpers and not those who need help. On the behavioral health provider side, we believe that that group is likely to have longer term needs as the pandemic goes on, since the mental health impact of the pandemic will go on for the general population even after the number of cases peak in different regions. People may have some level of protection from helping others, as people often marshal their strengths to step up. And people can feel better when they feel like they're actively part of the helping process. But behavioral health providers are as affected by the pandemic as anybody else. And so one of the things that's unique about the current moment is that it's rare to have a disaster impact so many people at the same time as we're seeing now. So one concern that we certainly have for the behavioral health community is emotional exhaustion, compassion fatigue, as this may emerge as people engage with smaller numbers of people reaching out for help after peak. Sometimes the adrenaline of the acute helping phase will wear off, and this can lead to an emotional slump. So it is important throughout that we encourage these groups not only to reach out for help even before they might get to a crisis point, but to emphasize self-care, coping, and connecting with peers as much as possible for support.
Thanks, and hopefully you can all hear me again now. There's also people who have not been sick, They haven't known anyone who's died. They haven't lost their job, but they're just chafing at other factors related to the pandemic, such as the public health requirements of wearing a mask or the social isolation. Not everyone's an introvert like me, I guess. They might be experiencing generalized worry about the world or even guilt at their good fortune. What do you recommend as good coping skills for these folks? Huong, why don't we go back to you again?
Thank you. Yeah, I remind my clients that each of us process intense emotions in different ways and at different rates. Some of us internalize, others externalize. Some talk about what they are feeling, others prefer to keep quiet. Some will turn to intense baking, others will binge Netflix, and others will do nothing at all. All of those are legitimate ways to manipulate, digest, and integrate feelings. There is no right or wrong way to react. And I remind clients that we are all having a very normal reaction to an abnormal event. So first of all, take a deep breath. Taking longer belly breaths as compared to chest breathing will just allow more oxygen into our brains and allow us to make decisions from our prefrontal cortex and a more rational perspective as compared to activating our flight or fight response. And secondly, I always work from a strengths-based perspective. So when clients come to me, I usually ask them, what have you done in the past during challenging times that have helped you? Oftentimes, my clients don't realize the plethora of tools they have in their arsenal to support themselves during this challenging period. And lastly, I highly recommend practicing self-compassion during these times. Dr. Kristen Neff is a leading researcher on the topic of self-compassion, and she describes it as the compassion that we have directed inwards, relating to ourselves as the object of care and concern when faced with the experience of suffering. And it involves just our innate capacity to comfort and soothe ourselves and to motivate ourselves with encouragement when we suffer, instead of the self-flagellation or self-deprecating comments that sometimes we make. The three components of self-compassion are self-kindness, common humanity, and mindfulness. I especially highlight common humanity, which is the feeling of being connected with others and the human experience instead of feeling cut off and isolated in our pain and suffering. During these challenging times, we can use the idea of common humanity to help us feel interconnected instead of overwhelmed and isolated.
That's a great point. Lisa, how about you?
Yeah, I think the first thing, as Dr. Diep also indicated, that for everyone to know that it is normal to feel anxiety during an experience such as this one. It's a normal response to the abnormal situation of the pandemic. I think it's helpful for folks to focus on things they can do, not just what they can't do and what they may be mourning in terms of losses in that way. There may be opportunities to explore alternatives online or in the home or social distance activities that adhere to public health guidance and where folks can participate in those activities. I would encourage them to do so. Also really important to focus on self-care, and that goes along with self-compassion. If you have compassion for yourself, perhaps the awareness that we're all deserving of self-care becomes more evident. And I would also encourage people to redirect their feelings of guilt. When people feel guilt, that's a signal to ourselves that, perhaps we've done something wrong and we need to make amends. And I would say, for those people that have had the good fortune not to be ill or have ill family members or to have lost their job or any of these terrible things that have happened, it's not that they're wrong for having had good fortune. It is the pandemic that is the thing that is wrong. And so I would encourage people to think about what are ways that you can redirect so that you can leverage your good fortune to help others. You can donate funds if you have them. Are there volunteer opportunities that people could take part in? Are there ways they can provide support to friends, family, neighbors, others who may be struggling? Are there ways to get active in the community to meet community needs or even to advocate with local, state, and federal policymakers to address the challenges that they are seeing in the community? So those of us who have the good fortune to have the resources and energy to get involved, I think it can be really helpful in assuaging guilt to get involved and be part of the helping process.
All great ideas. So Huong and Lisa, thank you. And we're going to move now to a few questions for Heather. So Heather, thanks for joining us. And, we've heard a bit about how funders get engaged with mental health or how they can, but New York Life Foundation has been doing grief work for a long time. Can you tell us a bit about your history and your signature philanthropic investments?
Sure. Thanks so much for having me. I just want to be sure everyone can hear me okay.
You're good to go.
Great. You can go over to the next slide. Just a little quick bit about New York Life. We are celebrating our 175th anniversary, so we're a young company. We are mutual, which means that we are owned by our policy owners, which allows us to make long-term investments and think with a long-term perspective. This is also the way we look at things at the foundation. We are lucky to have generous investment in philanthropy, which we've had for a very long time. And, when we look at the mission of the company, which is to provide financial strength and peace of mind through our products and services, we really take that same mission and we extend it to the community. On the next slide, you'll see that one of our core focus areas is the area of childhood bereavement. So obviously childhood bereavement and bereavement in general has a strong connection with life insurance. We are there for people during their darkest days, providing financial relief. But really our agents and our entire workforce are also providing additional supports. And through our work there, we realized that there was a lot more that we could be providing. So for over a decade, we've been investing in the field of childhood bereavement, which is simply helping families and children, learn to deal with their new reality. And as we've gone through this field, we have focused in a lot of different areas, but really looking at raising awareness and getting information out to the public. And I won't go into detail on the slide, but I think the most shocking statistic that people always sort of gasp at is this idea that 1 in 14 children will lose a parent or a sibling by the time they reach the age of 18. So before they leave high school, they're very likely to lose somebody important to them. And as you all know, there are a number of negative consequences potentially in dealing with the death of a loved one. On the next slide, you'll see the 3 areas of focus for the foundation. So the first is in research. When I started at New York Life about 7 years ago, we were about to embark on a huge sort of PSA campaign, and we had brought a bunch of partners to New York City to decide, what was going to be the thrust of that campaign. And it became very clear very quickly that we couldn't agree on any statistics. So right away, we decided that we were going to double down and invest in long-term research. And so we've partnered with a number of preeminent organizations, Yale, CHLA, Arizona State, and one of them, Judy's House, actually helped us to produce some of the statistics that were on the previous slide. They've done an estimation of the incidence of bereavement nationally as well as state by state. And the results, brought us that 1 in 14 statistic, and that's the national average. But as we see across the country, lots of things correlate with lower or higher statistics. So in my home state of New York, it's a lower incidence, 1 in 20. But if we go to a state like West Virginia, it's actually 1 in 7. Which is incredible if you think about the number of young people who are dealing with one of the hardest things to deal with as children. So in addition to research, we also invest in direct service. We have a number of partners that we work with across the country that are, bereavement centers, bereavement camps. We have a partnership with StoryCorps in helping young people to facilitate constructive conversations about their loved ones. It's incredible how many young people, folks are so scared to talk to them about the person they've missed that they don't actually have a lot of good information, and it makes them feel like they can't communicate themselves. We also work just generally to help increase capacity within the sector. Because although death and taxes are something that everybody faces, very few people actually want to talk about death and the trauma that follows. And so our work is in making sure people understand that this is a real issue, that it does need support, it needs funding. We are the largest funder of this field, but we are always looking for people to come along with us. And I think, what we've seen recently with COVID has really brought to light the idea of grief. And even if it's not primary grief where somebody dies, this idea of secondary grief, where people are losing friendships and losing their normal day-to-day life. Young people are missing graduations and proms, and which seem like a small thing in the face of death, but for a young person can be truly traumatic. And so how we help these children is incredibly important.
And in terms of disasters, how did you become involved in responding to disasters?
Yeah, well, if you take a look at the next slide, like I said, we've been around a long time. So our first known contribution to help with disaster relief was way back in 1853 with the yellow fever epidemic in the South. And, the timeline addresses a number of important events in our country's history where we have made large investments, partly because we feel it's our responsibility, partly because we have the financial strength where in times of crises we have been able to invest where others may not. And then partly it's, at least partly self-serving. We're a life insurance company. And if you look at the HIV/AIDS crisis, which was, a huge unknown and very worrisome, we felt that it was imperative that we understand what this disease was, that we destigmatize some of the things around, who was getting it and who was involved. And so we ended up being one of the largest corporate sponsors, investing about $32 million in HIV and AIDS research early on, as well as education. The other thing I would point out is just recently, after 2017, sort of the triple and quadruple whammies of all the hurricanes, we had the horrible shooting in Las Vegas, the Parkland shooting. We had been giving, initial immediate sort of assistance for all of those things. But when we got to the next year and we realized there were so many communities that were still hurting, we made the decision to do a longer term investment in a program with the Alliance for Strong Families and Communities that we called Building Resilience in the Face of Disaster. And that was providing long-term trauma and grief support for organizations in all of the affected locales to help them provide more trauma and grief support for the people who were still grieving and are probably still grieving today long-term. We are still investing in Newtown. We're still investing in a lot of places where others have left because we understand the longer-term impacts of trauma and grief.
So you've started to touch on some of the projects you've done. What are the ones that you found that, have so-called legs, there's impact over time?
Sure. So I'm going to go over a few of them quickly. The first is, we did a survey, about 7 years back with the American Federation of Teachers to try to understand grief in the classroom and how prepared teachers and other administrators felt to help students when they come back after suffering the loss of a loved one. And the results were astounding. Only 7% of educators had ever received any kind of information or training in how to help students. 93% of them said that that was something that was very much needed and that they wanted. And so we ended up starting a coalition. In the beginning, there were 10 organizations. It was basically all of the large membership organizations related to K through 12 schools. So the AFT, the NEA, school psychologists, the principals associations, both primary and secondary. And our partner was the Center for School Crisis and Bereavement, which is now housed at the Children's Hospital of Los Angeles. And what we did was we put together a web-based resource for schools that we had hoped they would go to proactively to learn about the kinds of things they could be prepared to do once a crisis hit. But what we've also found people obviously turn to once something happens. And the truth is that the site is really there for non-crisis situations, because every day children are losing people and they're coming back to the classroom. Every day there are children in the classroom who have already lost people who are triggered by various things, dates, holidays, being a kid. And so the coalition was born to help them. And out of that, New York Life created something called the Grief Sensitive Schools Initiative, which is where we send our employees and agents into the classrooms, any classroom, K through 12, public, private, across the school. They give a presentation about the resources. And then if the school pledges to strive to become more grief sensitive, we give them a grant to help them get on their way. The next slide, I think, just goes over some of the details there. Again, any K through 12 school, it's our workforce that is literally going school by school by school, with really the purpose of just raising the awareness of the prevalence and the importance of providing these resources to students. Next slide, please. Part of this GSSI partnership is what other resources can we provide to these GSSI schools? One really successful partnership we've had is with an organization called Furst Book that curates age-appropriate books for students and offers them at free to low cost for different communities. So all GSSI schools receive a set of free books to start their sort of bereavement library. So books that they can actually provide to students or peers and friends when somebody has died. And then in crisis situations, so for example, where we've had a school shooting or even with COVID, schools that are in, that can't afford to purchase these resources can receive free resources in the face of those disasters so that they can be better equipped to help their students. Next slide. One other project that we invested in a few years ago is called Speaking Grief. And it's primarily a PBS documentary that has been airing across stations since May. It'll be aired, I think, on 75% of all PBS stations. And it follows 5 families and their experiences with grief. And really, again, this goes toward our goal of just raising awareness, letting people know that grief happens in many different ways. It doesn't end. It doesn't just disappear. And with the documentary, there's also a public outreach and education campaign. We'll be doing events in multiple cities, many of them virtual this year. The plan had been to do them in person, but they will continue through 2021, some of them being in person, where we work with local PBS stations, local bereavement centers, again, to educate the public and view the film. One thing that we did on the next slide that came out of Speaking Grief was when you sponsor a documentary, you usually get like a 30-second spot, before and after the show where you can talk about your company, et cetera. So instead of doing that, we decided that we were going to create our own story. And it was a story of a little boy named Kai who lost his father. And he discovers something that helps him. And the idea is that this is going to be the first in 3 books that follows Kai through his first year after losing his dad. We have a promotion where if you download or view the book or the film, which is all free, on our website, we will donate $1 to one of our bereavement partners. And if we can, I'd like to show it here. No guarantees. I know it doesn't often work, but we'll try it. And if not, we can provide the URL so people can see it themselves.
Kai had felt sad before, but this was different. Something more. Mom didn't show it, but she was sad too. Without Kai's dad, their whole world was turned blue. But this didn't mean they'd be frightened forever. Brave sometimes hides in the strangest of places. For Kai, that place was a sweater. Just when he felt he might never be bold, Kai's world was changed by a sweater of gold. What kind of sweater makes you brave when you're sad? The kind that is stitched with the love of your dad. Suddenly, he realized that right from the start, the same brave in its stitches was stitched in his heart.
So you may or may not have noticed, but the voice on that film was Maya Rudolph, who actually lost her mother when she was a young girl. And so, encourage you to go to our website, download, share that. There's a discussion guide for both teachers and family members to have with children as they read through the book. And there'll be 2 more books through the end of this year and the beginning of next year. So the next thing I want to talk about is something that we recently did related to COVID. So the company looked around and sort of said, what are the things that we could provide during this time? We asked one of our partners, Cigna, to join us, and together both of our foundations seeded a fund called the Brave of Heart, with each with $25 million. And the point of Brave of Heart is to provide financial assistance as well as some mental health supports to the families of frontline healthcare workers who die fighting COVID. So if you go to the next slide, what this means is for family members of any healthcare worker or volunteer that worked in a healthcare setting who died from COVID. So that includes doctors, nurses, orderlies, cafeteria workers, anybody who's knowingly going into a facility day in and day out where they're exposed to COVID. Their family members can apply for up to $75,000 in disaster immediate grant support, just to help them, cope with the financial loss of losing their main breadwinner. And it was really born out of this idea that, these were essentially the firefighters of COVID, right? They're going into the burning building while the rest of us are staying home and doing our part there. And we've been raising money. New York Life has also committed another $25 million to match individual donations to the fund. And we've recently started granting out dollars. So we've already granted out $1.6 million in the first phase of grants. So this is just another example, I think, of trying to evaluate the situation at hand, trying to find a way that we could use our expertise to provide something that we saw as a gap, that wasn't available, and then encouraging others to join us.
That's great. And we're just a couple minutes away from going to our Q&A, but last question, Heather. As a leader of a philanthropic organization, especially one that is located in New York where we saw such huge outbreak, how are you handling the disruption of this pandemic, and how are you encouraging your own staff members? Yeah,
so, like most companies, we made a bunch of immediate donations to things that were handling pressing needs. The one highlighted in red was to our own emergency assistance fund. So like a lot of other companies, New York Life has a fund set up for our own employees and agents for when they're affected by disaster. And in the past, it's been, their car was damaged in a hurricane, or maybe they had to evacuate because of wildfires. But now it's really to help folks who are hurting because of COVID. So while we have not had to have any layoffs at New York Life, the spouses and domestic partners of our employees and agents have been laid off, and they are feeling financial pressure. And so our own assistance fund is there to help them, give them some small relief where we can. And so we bolstered up that fund, as well as, other things, helping our own grantees, for example. The next slide just shows some other things that we did to both help our own employees and agents, but as well as our customers, which is just providing resources, tapping into our experts to understand how COVID and really recently how social justice issues are affecting communities, and some tips and steps on the things they could do to learn more or to help cope, et cetera. And one last thing I'd point out, it is our 175th anniversary. We were planning a year of celebrations. That didn't happen. But again, we've been around a long time, and on the day of our 100th anniversary, FDR died. So we're pretty used to things stopping celebrations on our end. But instead of doing that, we had planned a big celebration on April 27th, celebrating, our anniversary. And instead we converted it to something called Love Takes Action Day, where we encouraged all of our employees and agents to do small acts of kindness for people in their communities. And we've now essentially had that expanded for the rest of the year, where we incentivize folks to do those things, because we have a huge culture of engagement and volunteering. But unfortunately, because most people are stuck at home, they haven't been able to do that in the traditional sense. And so we're looking at ways that we can encourage them to do other things, make phone calls to people, make care packages, even just spending time with their own family, frankly, and allowing people to have that space, I think, is important. Recently, just asking them to take some time to read a book about how to be anti-racist, or how to be an ally at work. So those are some small things that we're doing at New York Life to help our own stakeholders.
Thank you. And so we're going to take a few questions from the audience. Huong, I think I'm going to come to you first. Really, we're facing two pandemics. So the COVID-19 pandemic, and then the racial crisis that's both ongoing and exacerbated recently. So how do you address the trauma, the dual trauma of the two of those at the same time?
Yeah, that's a great question. And it's something that, there's no simple answer for that one, but I think the first step is even just acknowledging and validating that this is something that has been, especially with the racial trauma going on, for many, many years, and that is part of potentially intergenerational trauma as well that has been passed on, through the different generations, and that a lot of what, one may be experiencing right now is not just, the stressors from the current climate, but also from years and years of oppression. So I think for my clients, what has been helpful is just having a space and platform in which to validate, normalize, and for them to be seen and to know that what they're experiencing is real, and starting to unpack, some of that. And I think coming from, as a woman who identifies as a person of color as well, I think sometimes it is sharing my own experiences, obviously in a professional manner, but that helps to for my clients to not feel alone as well. And I think that healing occurs in collaboration in groups with others, that healing isn't in isolation. And so I think for sending my clients to and different resources and to know that they're not alone, I think I have found to be the most helpful.
And linked to that, Huong, if you want to start and then we can open it up, was a question about, with both the access to family and family supports or friend supports, but losing loved ones and not having the traditional processes available of family support or having a funeral or typical service. How do we think this unresolved grief is going to impact our communities?
Yeah, I think that's a question I grapple with as well. I mean, I think in terms of, I hate to use the word unprecedented because I think it gets overused during these times, but there's where it's sort of this big social experiment right now that we're all going through to really see how we're all reacting and what resources, we're coming up with. But what gives me a lot of hope is I think that we are all very resilient beings and coming up with very creative ways to grieve and to honor our loved ones who are no longer with us. And, I think within different racial, cultural, ethnic groups of honoring what maybe, has been done in the past and trying to find ways to utilize aspects of different beliefs and value systems and coming up with creative ways with social distancing, and not being able to have some of those more formal ceremonies and whatnot, but finding ways that you can still grieve and be together in community, even apart.
And Lisa or Heather, anything to add to that one?
No, I think that was very well said.
Okay, so a question maybe then for Lisa and Heather. We have a few questions that tie together and look at a topic we addressed a couple webinars ago, but about the age spectrum. So the difference between the mental health needs you're seeing with children who miss their family or their school, their friends, and then the elderly or older adults who are, with the nursing home, congregate living, or just because of their own risk factors, seeing their friends and peers die and experience anxiety. So Lisa, maybe can you talk about anything you're hearing about the older populations? And then Heather, I'd love for you to address the grief for kids.
Thanks. Yeah, older adults are a group that has been highlighted from the beginning of the pandemic as at considerable risk from the disease. But there are all of these social factors that you just talked about that not only affect older adults, but also their caregivers. So, many times when we're thinking about older people, we need to be thinking about the constellation of family and caregivers around them. So I think one of the hardest challenges has been for older adults living in congregate settings or in care settings, isolation. Certainly I've heard stories of older adults needing to be locked in their rooms for much of the day as a precaution that the institution that was caring for them was taking. That is profoundly isolating. When caregivers who normally come and visit or who help to provide care can't do so, that is incredibly isolating and distressing, not only for the older adult, but also for their caregivers and relatives, and certainly even for older adults who may not be in a nursing home or assisted living, but who may be receiving treatment in a hospital. We've heard lots of stories of the distress that comes when family can't even visit, and concerns from family members. What if my older loved one dies alone? So I think the grief has been anticipated. It has been exacerbated by the reality of the circumstances under which we are providing care and trying to protect older adults. And sometimes the things we are doing to try to protect them can also contribute to significant emotional distress. So it's a real dilemma to find ways to be protective and help people stay connected.
Thanks. Heather?
Yeah, I mean, I think with children, there's research that shows prolonged absence from school and disruptions like this do have a negative effect, not only on academics, but also on social emotional behaviors, and especially at crucial ages and transitions that can be exacerbated. But, really children are dealing with a lot of things. There are some kids that are already experiencing grief and other adverse childhood experiences where this is added to that. So it's cumulative trauma and cumulative grief. There's a whole lot of uncertainty, and kids really of all ages, but especially young kids, like to know, I do this for this long and then this thing happens, and they like to know that something is finite. And so having, all this uncertainty, will they go back to school? Won't they go back to school? Will they go in person? Will they be at home? Nobody likes that, but children, I think especially, find that hard to deal with. And then I think, there are, again, these secondary impacts whenever we see trauma and grief, the financial impacts of a lot of folks losing their jobs, a lot of food insecurity, which hits children very hard, not being able to get meals at school, and some of the other social supports that a lot of children across the country are able to find. And then you have the social justice upheaval. And I think, that to a certain extent has been there, but I think being home, being on screens, more children have been exposed to more information about this now. And so, they're dealing with it in many cases being isolated, wanting to be a part of the solution, being told, very different things about how they may or may not participate. And so all of that, just adds up to a lot of uncertainty. And what we've been doing is working with school districts across the country on prepping teachers and administrators on how to talk to students, what to prioritize, and also just how to notice, and how to ID warning signs with children. When does it seem like children are having really adverse reactions to all of this, and they're going to need to have some specialized interventions? And on top of that, especially from a school standpoint, is just the whole idea of how will all of this additional resourcing be funded, because most school districts are facing budget cuts, and it's not entirely clear if the federal government will step in or will step in at the right level. So there's a lot of uncertainty. I guess there's some comfort in knowing that all kids are going through this together, so at least it's not a pocket of kids. But as we know, children who were already in lower income situations or under more stressful situations will feel this doubly, if not more.
Great. So we are at the top of the hour, so I want to share a few takeaways from our conversation. I heard that it's important to be flexible. We need to adjust our deadlines, recognizing that it could take quite a while for mental health symptoms to appear. Look out for vulnerable populations that may have high needs but have very little attention or response infrastructure in place. So work with organizations that have the trust of vulnerable populations and can reach out to them. Don't reinvent the wheel. Repurpose or adapt your existing resources or others' existing resources for use in the pandemic. And be a good and patient listener. There's a lot of stresses and strains on your grantees, fellow funders, and your community. We know that there's an ongoing need to assist with recovery efforts over an uncertain length of time. So CDP and our partners at Candid are tracking philanthropic donations. As of July 12th, that total stood at $12.4 billion. CDP has many disaster philanthropy resources. We have our COVID-19 response fund, and our staff is always available to find guidance or provide guidance. You can find more information about us at disasterphilanthropy.org. And then very exciting, today CDP is launching our brand new strategy toolkit, tip sheet, and compilation of resources to help philanthropy discover strategies for supporting mental health, grief, and bereavement after disasters. And we've done that in partnership with New York Life Foundation. And you can find these resources and many more on our Disaster Philanthropy Playbook at disasterplaybook.org. And this is the last and final webinar of 9 that we've presented over the last 3 months. This recording and all of the recordings are available. And a big shout out to our tech guru, Ruja, who has managed these tremendously for us. So to respect everyone's time, we're going to wrap up. Lisa, Huong, and Heather, thank you for taking time to share your insights. And to the New York Life Foundation, Heather, for being our partner in this webinar and toolkit. Thanks to our co-sponsors, Interaction, the National Voluntary Organizations Active in Disasters, Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Cities. Thank you to all of you who joined us. As the webinar ends, a brief survey will pop up. Please take a moment to share your thoughts. And if you have questions that were not addressed during the webinar, you can add them in the survey, or you can email them to me at tanya.gulliver-garcia@disasterphilanthropy.org. Thank you, stay healthy, and have a good afternoon.